they have a concept of the material that we're coming from.
Sure. Good afternoon, everyone. I'm so happy to see everybody already active in the chat. I super appreciate that. It makes it a lot more connective for us all that we're all here, and we're all coming from very different places. I've seen lots of different places in the chat, so thank you all for that. Thriving Students is a program where we use trauma-informed and positive education to educate educators in trauma-informed practices, and really helping to create, working with the health and wellness teams and individual teachers to create really tailored and individualized interventions for students with challenging behaviors. And it's actually something that I have some experience with prior to coming to Southwest Family Guidance Center. As a teacher myself, I had a school psychologist with whom I worked with, and he was trained in Dr. Pierce's material, that the trauma-informed practices. And so while I was a teacher myself and looking for some additional support, found myself working really closely with a psychologist. Ooh, that is scary. So he actually gave me a lot of this information prior to me coming to work with Dr. Pierce. And so it was really incredibly helpful, and it really helped to change the way that I saw my students with the challenging behaviors. And I definitely attest to this, and I fully support all of what we're doing, and it is definitely life-changing and can really change the way that you practice in the classroom, and really helps to provide some different ways of looking at things. And we also work really closely with the health and wellness team to help them think outside the box of the regular interventions that students may have had in the past that just don't succeed, or they are not successful with those. And so that's really our goal, is to be a little bit more tailored, a little bit more personal, and then really working on the connection that you have with students to really make these interventions work.
All right, thank you, Leilani. Lonnie has her master's also in family studies, and so this is great because she's putting together her educational background along with what she can do for families. And ultimately, as educators, as clinicians, that's what we're all doing. We're working with families to support their children in thriving academically, socially, and emotionally. So I'm going to divide this up in two sections today. The first section is going to be understanding trauma. Some people on this are being here again for a second time, and thank you for doing that. And so there's going to be some review for you. Hopefully it's really worthwhile, because it's always good to hear things again and pick up on things again and be reminded again, and a little bit of more information than what we shared the last time, a little different. But I wanted you all to have an introduction to trauma-informed education, which really just means understanding the impact of childhood, adverse childhood events, ACEs we call them. What's the impact of high levels of ACEs, trauma, abuse, and neglect, and I also add chaos to that, because it has a profound impact on children and their developing brains, and them emotionally, socially, physiologically, etc. And we'll talk about that. And how does that show up in the classroom? And for you all, as early as early childhood, it already will be showing up. And we need to attune to it, kind of the upstream. If we can understand and make appropriate interventions early on to make a difference for those ACEs that they're dealing with, then we can prevent so much downstream. And that's the idea. The second part I'm going to talk about today is resilience, educator resilience. I don't think I need to tell you that being an educator in the first place is just damn hard work on so many levels. The physical energy it takes, the planning time it takes, the emotional energy it takes, the knowledge educationally, everything that goes into being an educator. And on a day-to-day basis, how hard that is. And now we're layering COVID on top of that. How it's impacting the way you're delivering your education. Some of you are doing that virtually, some are doing it with a hybrid model. Some of you are working from home and have your kids in the background. I love that. And navigating whatever this is meaning for you, both educationally and personally, what it's meaning for you. So I want to talk about resilience because our children, whether it's our own children or our students, will only be as resilient as us adults are. So that said, our wholehearted goal in our Thriving Students program is to radically change the negative trajectory of failure and exclusion for children as early childhood, where kids are really struggling behaviorally, emotionally, and not being developmentally at the appropriate age for their chronological age. They are already not regulating, already not academically succeeding. And in the worst case, even in preschool, they're being expelled because they're so disruptive and even hurtful to other kids that we can't have them there. Understandably, but how tragic that is, that that's your beginning. So we want to create school cultures that inspire success and inclusion. And the more we know about trauma, abuse, and neglect, and its impact behaviorally and emotionally, and then academically, the more we can intervene in a way that will support success and inclusion. So trauma-informed psychology is the understanding that each person is a creation of their own experiences. I often quote Dr. Bruce Perry, who's a leading expert in childhood trauma and its impact on brain development, that a child will become exactly who he was exposed to, or a child's brain will become exactly what it was exposed to. What it was exposed to or what it didn't get that it needed for healthy development. And again, a good example of that is just language. We all know that children are born with a capacity in their brain for language, as we are born for capacity in every other way. But it takes patterned, repetitive, repeated experiences with a language to develop that part of the brain. The language part of the brain has to have experience to create neural pathways in that part of the brain. So we talk to our infants. We even talk to them when they're in utero. We talk to them, we repeat things, we talk baby talk, we do repetition, we do nursery rhymes, we read to them, all in whatever language we speak. And ultimately, they grow up speaking that language because that's what they were exposed to. And what's important, and we know all that, right? That's evident. But what we forget is that that is no less true for any other part of the brain. The social emotional part of the brain, the regulation part of the brain, the part of the brain that has us pick up on social cues, the part of the brain that helps us sensory regulate, emotionally regulate, empathize. Those are all parts of the brain that we have to have experience for in order for that part of the brain to be developed and create neural pathways. And when we have childhood trauma, abuse, neglect, chronic stress, and chaos, it's going to impact the development of those parts of the brain, and we'll see the results of that. So the mindset of trauma-informed is that we recognize the prevalence of trauma. Sadly, it is just way too prevalent. We make a connection between trauma history and behavior. As I think I point out in this PowerPoint, it's a matter of not so much what's wrong with the child, but what's happened to the child. If we understand what's happened to them and or what they haven't gotten that they need, we look at them through the eyes of what they need instead of what's wrong with them. And then we pay attention to what they need, to what triggers are for them that wouldn't be there for other kids because they haven't had these negative experiences. And we make informed responses. All too sadly, in the schools that we work in, IEPs, 504 plans, they come up with interventions for kids that are actually counterintuitive, or rather we need to come up with counterintuitive ideas, I think is a better way to say it, that it makes sense we do this intervention that would work for one child, but for this child, it's absolutely the intervention that will evoke the very response we don't want. And we'll see, I'll show you what we mean later. So we need to make more informed decisions, understanding the nature of what the challenges for this child are. So let's start with identifying what trauma is. Trauma is an event that is extremely upsetting and at least overwhelms the individual's internal resources. So we have acute traumas. Something acute can happen to a child or to us. A one-time acute thing, certainly it can overwhelm our internal resources until we're able to regain and restabilize our equilibrium, brain-wise, emotional-wise, physiologically, and then we can move forward. That's one kind of trauma, acute. And then there's chronic trauma, where in a high level of trauma, in a ongoing way, in a repeated way, repeated and ongoing, or it happens frequently and ongoing. So high level happens frequently, like could be daily or weekly, but in an ongoing months and years way. That's chronic stress. And a lot we're going to focus on that today. When we get to our resiliency section, we're going to remind you of this definition again, because is there anybody on this screen today that isn't extremely upset on a daily basis, maybe, by the impact of everything that's happening around us, globally, nationally, and certainly in our community, with COVID in particular, how it's impacting our lives, our economy, our work, our families, our own threat of health, safety. We are being stressed every day on a continuum, and on many days, I'm going to guess that everybody on this screen today in this community have a feeling of being overwhelmed in their internal resources to deal with it. So we're naming that we also as a community are in a trauma event that is in many cases high level, frequent, and in an ongoing way. We thought this was going to be over in just a very few months by summer, and here we are educating in the way that we are. And that doesn't include anything going on behind us politically, socially, that we're distressed by, to say nothing of how it's impacting our own personal lives and what we're navigating. So keeping that in mind. So quickly, the impact of trauma, abuse, and neglect, adverse childhood events. Let's take a look at what that means for us. Hopefully this is going to work. Dr. Nadine Burke, who is one of the leading people in our learning about the impact of trauma, abuse, and neglect in the development, is a TED Talk, TED Med. She is a doctor in inner city San Francisco. Let's just listen to what she has to say about the impact of trauma, abuse, and neglect. You good?
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or packaging chemical. It's childhood trauma. Okay.
So childhood trauma is what she's talking about. And again, it contributes to 7 out of 10 of the leading causes of death. It affects our immune system, our hormonal system. It increases our risk for heart disease and cancer by 3 times and can contribute to a 20-year shorter life expectancy. So I heard that many times as I've listened to this, but she goes on to explain something and in her more recent writing about why that is. Some of it we understand. People coming from a extensive background of ACEs are going to be more prone to substance abuse. They're going to be more prone to being smokers, maybe, to the kind of eating that can lead to obesity, or at least other heart conditions because of what they eat, maybe less exercise. So, you know, we can kind of brush that off and say, well, that's because of bad health habits. No judgment, but it's because they have bad health habits, and they're just higher risk for those bad health habits. But the interesting thing that they later started to find out is that even people with a number 3 to 4 ACEs, that's out of 10, by the time they were 18, that had never had any substance abuse issues and currently don't, did not smoke, were not obese, and didn't have some of the other contributing things to bad health outcomes, still had the same 3 times higher risk, 7 out of 10 highest contributing factors to issues, health issues, immune system and hormone system. So they had to look at, well, why is that? And the number one reason that is because when we experience trauma, stress, and chaos, or all 3, in a chronic way, we are invoking our stress response system. And it's that stress response system that releases hormones in our body that impact immune systems, other hormonal systems, brain development, etc. So we've learned a lot about the stress response system. Keep that in mind for when we get to resiliency, because we're experiencing repeated stress now, and we want to be sure that we're doing everything we can to mitigate our own stress response system being invoked. And Dr. Robert Block from the American Academy of Pediatrics is said to have said, the adverse childhood events are the single greatest unaddressed health threat in our nation today. Because if we don't address kids going through chronic, stressful trauma, abuse, and neglect, it's going to show up in the next decade to 2 and beyond if we don't address it today. So as I said earlier, the brain of a child will become exactly what it was exposed to. So let's see what that means. In the next video here, pay close attention to the distinction she makes between a child who has an MRI that's a healthy child and a child with a lot of trauma, abuse, and or neglect, and take a listen to what they say about the impact.
If we think of the brain as a massive collection of billions and billions of cells, it's the connections, the circuits among the cells that really are responsible for all the work that the brain does. Most of those circuits are developed early in life. And so literally the experiences that children have, the kind of world they live in, and particularly the relationships they have, literally shape and sculpt the architecture of their brain. And when the environment is not safe and protective, when it's violent, when it's unpredictable, when it is abusive, when it's very neglecting, it activates physiological systems that make your stress hormones level go up, particularly a stress hormone called cortisol. A cortisol level that goes up and stays up for days or months at a time literally poisons the circuits that are developing at that time in the brain. Whether it's the circuits for communication, whether it's the circuits for building trust in a relationship, you live with that disrupted circuit for the rest of your life.
One of the things children learn in the first year of life, particularly the second half of the first year of life, is to form an important relationship with at least one person, maybe more than one person. And for children who've been taken out of their home because they've been abused and neglected, put in one or more placements, they don't learn that. And so what you see is a growing inability to trust people.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
So many of the kids that you work with, and this is why we want to be attuned, have those disrupted circuits they showed and have so many experiences of what he calls the ugly, where they don't get what they need or they don't get reparation. They get unpredictable emotional responses, and they live in chaotic environments. And worse yet, maybe the recipients of some form of abuse. I'm always glad that that was a 2-minute experiment. I often point out that it was supposed to be 4 minutes. I'm sure that mother looks back now and wonders, did I ruin my child for life doing that? But that child got immediate reparation. That's a buffer, what we're going to talk about later. Buffers. She was able to attune and help get that child re-regulated and back connected again. And we're going to have those experiences. We've all had them, those of us who've raised kids. But fortunately, she couldn't tolerate it any longer than that. I don't think we could either. So it became a 2-minute experiment. So to understand the impact of trauma, abuse, and neglect on brain development, I like to tell it through the lens of the story of Amy and Tommy. Before I do that, I want to remind everybody, I don't think we said this in the beginning. I don't think Leilani said it, but please do chat. She was glad to see some chatting going on. Any questions you have, any resource you might want, anyway, she's here listening and perusing the chats. I can't see them and I can't respond while I'm talking. So she's in the background there or the forefront, facilitating any conversation between yourselves chatting for her to get information. We will save this chat so we can get back to you later or to your organization. Because again, we so appreciate your being on today, you're taking the time, your interest, and the work that we're doing and tuning into kids with these needs. We want to support you in any way that we can, even after today's presentation. So do feel free to contribute in the chat, ask questions, share reflections, and ask for resources. So Tommy and Amy, think of a continuum of 1 to 10. 1 to 3 being kids who get everything they need for healthy development, healthy attachment. Keep in mind that brain development and attachment go hand in hand. The more securely attached a child is, the more the brain development in all areas of the brain. The more disrupted a child's attachment is because of abuse or lack of getting what they need, the more disrupted the circuits are for brain development. So attachment and brain development go hand in hand. So, but Amy got everything she needed for healthy attachment and healthy brain development. I think these terms will come up later, but she needed predictable, patterned, repetitive, and attuned caregiving. Predictable, patterned, repetitive, and attuned. Leilani can put that in the chat. Caregiving. And that's what she got from in utero until she was 5 years old, when we'll see a brain map of her when she's ready to start kindergarten. In utero, her mother was excited to be pregnant, was not on drugs or any other substances, an occasional glass of wine, which she quit immediately as soon as she knew she was pregnant. Mom did not experience any high level or chronic stress during the pregnancy. And I'm talking about things like being in a domestically violent relationship in an ongoing way throughout the pregnancy, being insecure about where they're going to be living, some other high level critical stressors going on that have the mother release the hormone cortisol in her system, but then the infant's brain, the fetus's brain, also absorbs that cortisol, and that brain is going to be different just by mom's level of stress. But in this case, mom had nothing more than the normal stressors of life, and a supportive partner, Amy's father, and no substance use during the pregnancy, good prenatal care, etc. When she was born, again, she got predictable, patterned, repetitive, attuned caregiving. Mom and dad consistently responded, primary caretakers consistently responded whenever she cried. They were consistent in how they responded, in a nurturing way, in an attuned way. Is this a diaper cry? Is it a hunger cry? Is it a sensory cry? She's just lonely. You know how we walk them, we pat them. Is it she needs to be burped cry? And we keep attuning until we get it. And we get them calmed down, we get them regulated again, and we start all over again the next time they start crying. But in a consistent pattern, repetitive way, we do it all over again. No matter how tired we are. Anybody who's had an infant knows how exhausting that is, to show up every time in that predictable, nurturing, attuned, caregiving way. And she had no disrupted attachment by her mother and father. And sometimes another significant caregiver attachment can be whoever else, a nanny, a grandparent, even a babysitter, that they're getting predictable care by a predictable attachment figure that they feel safe with. And she had that. Routine and ritual are another really important part of early development. And she got that. You know, when we read stories to children, we have bath time and jammy time and our story time and lights out time. And we read our stories, and when we are dead dog tired and we want to skip a page, what happens when you skip a page of a story they've heard 30 times before? You skipped a page, right? And they know the story, but what's important to them is this is our bonding time. This is our attuned time. It's our ritual. You're not on Facebook. You're paying attention to me. We're snuggling. It's tactile. It's nurturing. That's aside from the language of reading and the story and the conceptualization. You all know the importance of reading. That's what she got. Tommy, on the other hand, is on the other end of the spectrum, 7 to 10. Where he's had multiple, by the age 5, probably 3 or 4 already, adverse childhood events in his early little life. When his mom was expecting him, she was not happy to be pregnant. She had a year-old child already by a previous relationship. She was living with his father, who was very domestically violent. She was using meth and marijuana. I'm not sure about alcohol. She said she quit the meth when she got prenatal care at 6 months, but he was born addicted. They were couch surfing, so to speak, from month to month, sometimes week to week, figuring out where they were going to live. You can only imagine the high level of chronic stress for mom during that pregnancy. Now, when he was born about 2 weeks later, she decided to leave his dad and get away from that situation and get respite, and came back to New Mexico from another state and came back to be with her father, who was her childhood physical, emotional, and sexual abuser. Brain of a child goes back to what's familiar, sadly. And when she came back, sadly, as it all too often happens, she continued to connect up with other abusive men of her domestically, and ultimately of her children. One of the things we want to be aware of is that domestic violence is as impactful to children as if they themselves were abused. Children who witness domestic violence but are never themselves the victim of overt direct physical abuse have higher rates of mental health issues later than children who were the direct recipients. Not sure exactly why, but I say that because we too often minimize. Well, mom was domestically abused, but he never hit the kids. Well, needless to say, we're glad he didn't hit the kids, but witnessing their primary caretaker, their survival mode being abused, the chaos that leads up to a domestically violent incident, the aftermath of that, all of that profoundly affects children. So not to minimize that, well, they weren't abused, they were profoundly impacted. So that was Tommy's experience. And when he was about 4.5, he was removed from the home because of an incident that happened by mom's most recent boyfriend of domestic violence. He witnessed his 1-year older sister being sexually abused, and sadly, his 1-year-old subsequent sister being sexually abused as well. But he got removed, and the one blessing in all that is that he was placed into foster care, that one foster home, so it wasn't multiple. They were very attuned, trained by Dr. Perry, had a therapist trained by Dr. Perry, and they ultimately adopted him. So over the next few years, he did get predictable pattern, repetitive, attuned caregiving, and made significant progress in his development. But I want to show you the brain map of Tommy and Amy. Now, a brain map is from the neurosequential model of therapeutics developed by Dr. Bruce Perry, who's from the Child Trauma Academy. And again, he's one of the leading experts internationally on the impact of brain development on children who've been experiencing childhood trauma. So the brain map on the top is of Amy. Now the brain develops from the bottom up and from the inside out. So the bottom at the top there where you see the darker green, that's the brain stem. And then in the middle is the lower and upper middle part of the brain, the diencephalon and the limbic system. And the upper yellow part is the prefrontal cortex, the upper part of our brain. That's the last part of our brain to be developed. So according to the key over on the right, her brain stem and all the functions, each one of those squares represents a function of the brain. That part of the brain needs to have experiences to be developed, to develop neural connections. So you can see that her brainstem is fully developed. All the physiological things that controls. Again, this is that age about 5. The lower middle and upper middle part of the brain, light green, that means it's exactly where it should be for a 5-year-old. By about the time she's 12-ish, that should be dark green. And by the time she's about 18 to 20, the upper part should be dark green. So for a 5-year-old, that's exactly where it should be. The yellow part up there, she has capacity for all those parts, but they're not fully developed yet. But that's why we do so much repetition. Make good choices. I keep hearing my daughter-in-law tell my grandchildren who are 3 and 5. Ava, how do you think that makes Owen feel when you say that or when you bop him on the head? Trying to get her to make the connection. How do other people feel? She gives language for Ava's feelings. You're feeling really disappointed. Yes, and she cries, and that's what gets her calmed down because she's being heard. She's hearing language for her feelings, and that repetition is what's developing those parts of her brain. Now, as you can see, the bottom brain map is Tommy's. I personally did this brain map because I was in a 3-year training with Dr. Perry. And I always say I repeated it twice. I did it and then I did it again thinking I'm making a mistake. It can't possibly be this bad. And I did it a 3rd time because I had to present it to him, the guru. So I didn't want to look stupid. But I kept coming up with the same result. And Dr. Perry did say this is one of the worst he's seen. And keep in mind, Tommy, and I didn't tell you everything, you don't need those images, but he is a 9 or a 10 on that continuum. But you can see even the lower part, the brainstem, isn't fully developed by kindergarten. The lower and middle parts significantly underdeveloped, which is pink, and then the rest of it. Those 2 children are showing up to kindergarten with this kind of discrepancy. There are 4 domains in the brain, basically. Sensory integration, self-regulation, that includes physiological regulation, emotional regulation. Those 2 areas are kind of loosely connected to the lower part of the brain, the lower middle part of the brain. The relational part of our brain, which is the lower middle and upper middle, ability to pick up on social cues, ability to empathize, ability to express language. Then we get into the cognitive part of our brain, the upper part. We need to be well regulated in the lower part to access the upper part. And as you can see, Tommy is the blue and Amy's the pink, very sexist, I know. But you can see that he is at half the capacity in all 4 areas of the brain as she is. And yet that kindergarten teacher is probably expecting him, like her, to function like a 5-year-old showing up in kindergarten, to be able to pick up as kids at 5 can pick up on social cues and get along with other kids, to want to connect with the teacher, to want to learn, to be able to sit in circle as long as other 5-year-olds can sit in circle, to be able to listen to a story for the length of time other kids can do. But he is at half the capacity because he may be 5, but developmentally in these parts of his brain, it's like putting about a 2.5 or 3-year-old in a kindergarten class and expecting them to function well like another 5-year-old. Would any of you do that? Put a 2.5-year-old in a kindergarten class? But that's what we do when we put a child like Tommy. Now keep in mind there's that 4 to 6 range where kids have some things happen, but they may have some buffers that help them with it, or they had some things happen, but they got enough of what else they needed that they're going to be that more resilient child. And if you raise that blue bar up halfway more, that would be maybe your 4 to 6 kiddo. But that's still some significant difference between that child and an Amy. And keep in mind, this isn't intelligence. This is just her brain development, as it should be. She's just a normal, healthy child. She's nothing exceptional, except that she got everything she needed for healthy development. So this is something that we overlook at when we talk about disparity in our culture. There is disparity in our culture on so many levels, socioeconomically, racially, gender-wise, sexual identity-wise, all the things that contribute to marginalization, to bias, to prejudice, to disparity is certainly all there. But one of the things we don't take into account enough is this level of disparity. This is why disadvantaged kids can't pull their bootstraps up, so to speak, like somebody else, because they don't have bootstraps. Tommy doesn't have the bootstraps that Amy does. And an Amy can be a child from low socioeconomics and still get predictable pattern, repetitive, attuned caregiving. She may have less economic advantage than another child, but with the right opportunities, she can take advantage of them because she's on par with other kids to be able to make use of scholarship advantages or programs that she can be in and ways that she can still fully achieve. So we have to be very careful when we say, look what so-and-so has done. She pulled herself up out of poverty or out of whatever, but that's because she had bootstraps. And we're looking at the kids without bootstraps. An important thing to remember in all of this is Tommy's and Amy's, where they're functioning in their brain. Every day in your classroom, you, for one, and every child in your classroom are functioning in a state of sensory arousal that is impacting hormonal release and activity in your brain. And so when we are calm and regulated, we're in the upper part of our brain. We're in charge. Even if we have some mild stress, we can talk ourselves through it. We can tell ourselves some self-talk. Lilani said such and such to me, and she must really think I'm stupid, the way she talked to me, or she's whatever. She's really judging me, or that was so. But then I can talk myself through it if I'm up here. I can, I wonder if she really meant that way, or she's just having a bad day, or she said it that way, but it's really her husband she's mad at, but she's being kind of snarky with me. I'm just going to ask her. That's what I would do. So Lilani, are you mad at me today or what? And because, you bit my head off. And she'll say, oh, no, I'm sorry. It's not you, it's my husband. He was an oaf this morning and I'm still ticked off, and good, we're kind of back regulated. Or she might say, yes, I'm mad at you. One more commitment you made for me. You volunteered me for one more school and 3 more hours of work. Who do you think I am that I can do all that? And then we'll work it out. But it's that checking it out. So, but I can navigate whatever stressful response I'm having. But as I get back into my alert and alarm part of my brain, I'm going to get more reactive emotionally, physiologically. I'm going to release stress hormones, especially when I get into that limbic system. And then I'm just going to get reactive because my upper part of the brain is sort of shutting down. And now I'm in fight or flight mode. And I want to remind you that we respond in our brain and in our stress response activation the same way when we're emotionally threatened as we do when we're physically threatened. If you're out for a walk in the woods and you turn the bend and you see a bear, you're going to go into fear and or terror, fight or flight in your brain. You're going to release cortisol, you're going to release adrenaline, and you're going to take fight or flight. So you're going to run and get away from the bear. I hope you don't think you can fight him. Hopefully you'll drop to the ground and play dead, because that's the other option, is to go into just a fight, flight, or fright mode. So you just shut down. If you are feeling emotionally threatened or triggered, you will go into the same part of your brain. And it's really important for us to remember that, especially for the kids we work with. If a child has experienced a lot of threat physically and or emotionally, and you as a nurturing teacher come up to them and touch them on the shoulder and look them directly in the eye, trying to get their attention to redirect them, you just triggered a threat in them, because an adult looking you straight in the eye from above and touching you can evoke two triggers. The number one trigger the number one precursor to sexual abuse is appropriate nurturing touch that becomes inappropriate and something wrong. The precursor to most physical abuse is towering over the child, yelling at them, looking them in the eye intently and saying, "Didn't I tell you?" and then hitting them. So again, whatever the trigger is, we have to be aware that children are triggered over and over and over. Tommy, when he shows up to school, is already in the limbic part of his brain, that state of arousal, perusing the room for emotional danger and maybe even physical danger. Amy assumes the world's a safe place to be. She shows up in the upper part of her brain, calm and regulated. So even when you need to direct her, because she's a 5-year-old and she gets off task, or she talks too much, or does things that 5-year-olds do, and you redirect her, she doesn't see it as a triggered threat. He does. And that's what we need to focus on and understand. So we really need to notice, pay attention to what state of arousal they're in. What state of arousal are we in? Think ahead when I get to the resilience part of our training. We all, on a daily basis, just watch the news tonight at 5:30. I guarantee you, your brain neural pathways will go into your limbic system. One, the news reports are meant to trigger that response, to get us emotionally reactive. No matter where we are in the political scope of things, where we are on the social scope of things, we watch the news, it evokes an emotional response. When you go into your limbic system, you release cortisol, you release adrenaline. And we're doing that repeatedly all day long nowadays. So keep this chart in mind, that that's what we're doing to ourselves, on top of all the other stressors we're dealing with in life. So how do we support these children? How do we be more informed so that we make good choices for them and we aren't the very trigger of the behavior that we're trying to reduce? Well, one, like we said earlier, trauma informed means we link a trauma history to behavior. We understand that kids from the center out that have traumas, emotional traumas, physical traumas, and do keep in mind, chaos is a trauma because it's high level stress, frequent and chronic. When we're living in chaotic situations, chaotic in that there's just constant change in the family, chaos, yelling, disorganized environments. It's unpredictable what the schedules are going to be. Sometimes mom's working graveyard, sometimes she's working days. I don't know what caretaker I'm going to be at. Sometimes dad's here, sometimes he's not. Sometimes I go to dad's and he's present if they're in 2 households. Other times he just shifts me off to somebody else. Always an unpredictable, I can't get stabilized kind of environment. So if they're coming from that, they're going to have constant triggers. Even coming to school or preschool is a trigger because I don't know if the teacher's going to be there or absent. She was gone yesterday. I don't know if she's going to be there today. There's somebody here in charge I've never seen before. What that means for me is they may not think it consciously, but they immediately go on red flags for there could be danger here. There could be a bear right around the corner. That's the mode they go into. And that trigger is going to drive their behavior. Their behavior is going to be very much based on thoughts, feelings, and assumptions. So our job as educators and what we do in our Thriving Students program is we really partner with schools and wellness teams and teachers in our coaching to, one, let's know as much as we can about this child. Is a family's been able to share with us. Let's make some surmise to some extent. We don't want to make negative assumptions on the one hand, but knowing what we know about his environment, what mom or dad have told us about their experiences, disrupted attachments, or what a family has shared, what could we surmise would be that child's assumptions about the world, their feelings about the world, how they think people see them. Let's surmise what they might be triggered by so that we can predict and prevent those triggers, so that we can change the assumptions that they make, because they're right to assume that in their chaotic, abusive environment. And even their behavior might be a good adaptive behavior at home, but at school, they can't just run out of a room. And at school, they can't do certain things. Those things will get them in trouble. Or they're just simply being reactive in a way that's unsafe to other kids, and we have to be reactive too. So this is a good start in understanding them. It's changing our mindset from what I mentioned earlier, what's wrong with them, to what's happened to them. And I want to remind us we need to take that same perspective of parents. It's easy to judge parents. In the earliest years of my career, my very first client privately, and I was 30 then, I won't tell you how many years ago that was, a good 10 years or so, the key word being or so. But many, many years ago, literally my first client in my private practice was a child referred from CYFD. And he came in with bruises up and down his arm, some on his neck. Mom told me his legs and his bottom were bruised, and he'd also been sexually abused by mom's boyfriend, who she left him with when she worked graveyard shift. And you know, it was so easy to empathize with him. The bruises literally and figuratively were there. I could imagine, or I couldn't imagine what he had been going through. It had been more than just that one incident, but that was the one that was obvious, and mom then got out of that environment, and CYFD referred him. But it was an immediate response, on the other hand, in my empathy for the child. I immediately went to judgment of the mom. What's wrong with you, mom? That you can't see what's been happening to your child, that you could let this happen, that you would leave him with a man that you don't know that well. What's wrong with you that you couldn't have been seeing what was going on before this really critical incident happened? Very easy to go there. To give myself a little credit, because it's an empathy for the child, but I didn't understand mom. And the really good thing in this case is that in my empathy for her as well, I was able to listen, she was able to share, and she was my first teacher, worth more than any graduate course I ever took, about understanding generational poverty and abuse, because of her story and what happened to her her trauma, abuse, and neglect then impacted her as a parent. So being careful as we work with our families and we see what families aren't able to do or be for their kids, or we hear about the bad things that they overtly do or that happen to their kids, being careful not to judge them. They're doing the best they can with what they have. And there's so much more we can do for that. So we look at attachment, regulation, and competency. This is something that we can coach from this model. But if you're interested, it's by Blaustein and Kinneberg. Again, Leilani can give you any references or send you our references out of our slide at the end. This is where we would coach you from. The bottom 4 are the attachment blocks: caregiver, affect. When we do trauma-informed clinical work, we look at how is mom and or dad able to manage their own emotional affect? Are they highly dysregulated? Is their emotional reaction very unpredictable? Or is it fairly well regulated? I mean, we all have our moods, we all have our emotional moments, we all raise our voices, we might even yell, but not in the scary yelling, or not in that really unpredictable way, or in a constant way. We manage our stress, we get ourselves quickly regulated. We can even attune to the child, and we can even say, I'm sorry I yelled at you, I didn't mean to. I was just, you know, Leilani has young boys. She could say, I just got off a telephone call with Dr. Pierce, and he's driving me crazy. And so I'm sorry I yelled at you. It's really Dr. Pierce I'm mad at. And I know that it's scary for you when I raise my voice or when I bite your head off like that. So we're giving attunement, we're giving empathy, we're giving, like that video showed, you know, the good, the bad, and the ugly. That was the bad. She acknowledged it. She gave a buffer for it. She gave language for feelings, and she created reparation. And she managed her own affect in spite of her frustration with me. And then she was able to give consistent response afterward, and she was able to create the ritual and routines of her home afterward. We look at what's the caregiver able to provide? What are they not, without judgment? What do they even identify? I have such a hard time with. I have bipolar, I have drug addiction, I have anxiety, and I have a really hard time managing my affect. In my world, I can't create very good routines and rituals. I don't know from week to week what shift I'm going to be on, etc. We look at what makes these things, because these are the 4 things that children need for healthy brain development. And we try to look at, when we're looking at this from a clinical standpoint, what is this child needing? What are the mom and dad needing to be able to better provide affect management, attunement, consistent responses, rituals, and routines? Then we go to the regulation part. What are the parent and or the child needing in the way of identifying their own mood, their own feelings, their own emotional reactions? Then we teach them skills how to regulate or modulate those things. We teach them skills for affect expression, even as young as preschoolers. How to say what you feel, how to ask for what you need, how to set boundaries, even at this young age. My grandson, who's 3, and my granddaughter, who's 5, he's learning to set boundaries. He's learning to find words for his frustration that his older sister is endlessly micromanaging him. She wants a tea party. He wants to be out there raking the leaves and doing things with his leaf blower. They are so quintessentially boy and girl. And she gets frustrated and she's orchestrating him and he's trying to set his boundaries. No, I don't want to. And they're getting language from mom and dad on how to express those boundaries without bopping her on the head. Negotiate boundaries, ask for what you need, be able to say what you feel in a safe environment. And that all leads to executive functioning in the upper part of our brain, the development of ourselves as being in control of our environment, and a well-developed integration. It says trauma up there because this was originally a trauma model, but it could say developmental integration. This is where we've all come from in our experiences. This is where we are now as a result of what we got growing up, because we are all on that continuum from 1 to 10, and then got what we needed, what we didn't need. So this is where a lot of our coaching comes from, understanding what the child is needing. And when we work with parents in our Thriving Kids program, which are families that are involved in child protective services, what we tell them is, you may be involved in child protective services, but we wholeheartedly believe that every parent involved in child protective services, we wholeheartedly believe you love your child, you want your child, and you want to do right by your child. But you've been profoundly affected by your own developmental history in getting what you needed and not getting what you needed, and being impacted by your own trauma, abuse, and neglect. Because of the percentage of families that are in child protective services are in that 1 to 3. Many of them are in the 4 to 6, very few in the 7 to 10, because anybody can succumb to substance abuse. But the resiliency, if you got everything you needed and you still had some bad life adult experiences and or got impacted by drug abuse that took you over, your resiliency for getting out of the drug abuse, for recovering from the drug abuse, because you're going to have more internal resources and probably more external resources. You're more likely to be in a recovery way that you're not long-term involved in child protective services. So the bad news, the tragic news, is you've been profoundly impacted. No judgment. You shouldn't judge yourself, and we don't judge you. And the really hopeful news is that the gap between your greater intention of loving them, wanting to do right by them, but the gap of what you've been doing, either how you did hurt them or didn't see that somebody else was hurting them, or you're not being able to do better by them, that gap is absolutely, we can bridge that gap. And you know what? It doesn't even take that much to do that. So with our program, with therapy, with creating buffers for them, with teaching them the skills of emotional affect management, so that they are better prepared to get their kids back. They're more insightful about the impact of their own abuse, and they are able to have their kids back. And when they get stressed, their first go-to isn't a substance, it's their ability to manage the emotions that drive their substance abuse or drive their reactivity that has them hit their child. So we bridge that gap, and again, so when we look at our kids, it is so much we can do to bridge the gaps. Tommy, 3 years later, we redid his brain map, and he was about halfway up more. So he wasn't on par with an Amy yet, but probably by 10, because he got that foster family and they adopted him, and he got predictable pattern, repetitive, attuned caregiving that bridged those gaps in the next few years. For the most part, he can become equal to Amy by the time he's an adolescent in those 4 domains of the brain. That's the hopefulness that we also live in, the possibility that we live in as educators and clinicians. There's those 4 words if you need them again. That's the classroom that you want to create. And when a child like Tommy is very dysregulated in your classroom, you want to find ways to respond to him individually that are patterned, predictive, repetitive, and attuned. What can I do when I can plan and predict that for this activity that's too open-ended, too much noise, he's not going to do well with, because it's typically where he starts acting out in some way, because we look for patterns. If you look for a pattern of their most disruptive behavior, or where they have their meltdown explosive behaviors, which are the ones that are hardest for us to deal with, because especially in early education, they can be really hurtful to another child in the way of being explosive. So we have to really predict, and then we create a pattern, repetitive, attuned response to them that moves them out of that environment. He should be able to manage that. He's 5 years old. No, he's not 5 years old. And even if he should be able to do it, he's not. So why are you setting him up for failure? The question to ask, it's not what should he be able to do, it's what can he do? And more often than not, what he's not doing is because he doesn't have the ability. He knows the rules, yes he does, but he doesn't have the regulation ability to manage his behavior to follow that rule. Or when we work with older kids, he knows he's not supposed to just leave the classroom. Yes, he does. But when that's his only choice between blowing up or leaving the classroom, he's going to leave the classroom. That's what he does at home. If the teacher's raising her voice in frustration because the classroom's getting disruptive, and a raised voice means way trouble, trouble's coming, violence is coming, get out of the environment, go under the radar, go get lost somewhere outside under your bed. So he leaves the classroom. Now he's in trouble for wandering the halls. But he did an adaptive response. We really have to pay attention. So that's just a very brief oversight of what we mean by trauma-informed education, what we need to understand about where the child is coming from, what we can surmise by that, what are the gaps in skills that they have as a result of trauma, adverse events, chaotic environments. And keep in mind that right now, every family is a little bit more chaotic than typical. Some are able to stay more organized than others because there's the resiliency of organization in the home. And it's just really sad. There's another woman that works for us. Courtney is her name, and Lalani. I give them as examples because they both have 2 young boys, elementary age. They both have partners. They both have financial resources. While COVID is stressing them both, Lalani's working from home with 2 boys at home, learning virtually full time. It's hard for Lalani. She'll tell you, put it in there, and Lalani, how hard this is. They're struggling. But Lalani has, I've seen it, good resiliency skills. She deals with me day in and day out. I know she has good resiliency. She has good emotional regulation. She knows how to navigate the virtual challenges of having her kids learning virtually. She knows how to be in touch with the teacher with the pieces that she can't figure out. She's not worried that the teacher's going to think she's stupid or doesn't care about her, or she's not working outside the home with the babysitter, taking care of the boys. I'll make sure they get on the computer and get into their classes, but the babysitter doesn't have the skills for that, so they don't do it. All the things that get in the way. She has those external and internal resources. Courtney does as well. And so their kids, while they might be somewhat impacted by the end of the school year, they aren't going to widen that gap of disparity socially, emotionally, and academically like other kids will. That's not to minimize how hard it is for the kids and the parents. But when you look at that end of the spectrum, having resources to the other end. So think about, be attuned to the families, the children and the families that you're serving on a continuum, high resources internally and externally, low resources internally and externally, no judgment, just the lower, the less resilience, the less resources, how can we support them so that gap of disparity doesn't get just blown even wider. So let's talk about resilience. Resilience is if you need a bathroom break, go take one quickly if you haven't already, or a quick stretch while you're listening. We need to do that, not keep forging forward. But that said, I will just continue. I think it's pretty safe to say everybody on this screen is feeling, again, on a continuum, pretty relentless stress. Again, 1 to 3, low stress, 7 to 10, really high. It's high, it's frequent, and it's ongoing. I think most of us, in the very least right now, in relation to work, are at least a 4 to 6. So kind of think about yourself. Where on that continuum are you in work and in your home life, your personal life? I want you to start to think about your own resilience and what you're experiencing. So, the end of this school year, we will probably survive this school year. Undoubtedly, we'll survive it. But we don't want to look like the tree on the left that is barely alive. It's there, there's some life to it. I think some of that greenery is weeds coming up from the ground. But nonetheless, that tree is still living, but it looks like it's pretty haggard and pretty on its last limb, literally and figuratively. That is not how we want to come out of this school year. That is not how we want to feel on a day-to-day basis. I'm surviving, because that's surviving. On the other hand, we want to live in the possibility that we can currently thrive under this stress, and that at the end of the school year, we will thrive, come out, have thrived. We will contribute to the thriving of our children, bridging gaps for them. We will contribute significantly to the thriving of our kids, students, families. That we will all come out of this year thriving. We will be impacted, but we will be thriving. And I hope that you can join me in the wholehearted belief that we can do that. That's a possibility. In order for that to happen, we need to be very mindful and intentional, which I'll talk about. But this is how we're going to feel some days. I think it's how we feel. I feel this way today. Literally, Leilani and I were on a conference call today with a school in Santa Fe. I could not get in, period. Google required something of me. I couldn't get in. So after a while, I got frustrated and I said to Leilani, because she was trying to help me, poor Leilani, her patience with dealing with me in technology. She's always trying to keep me regulated while she's staying regulated. So take a deep breath. We'll just call in. So I called in. That worked until it didn't. I got kicked out of I won't give you the details and take the time, but I didn't even get to stay on by phone. It's just exasperating. And then there's that. And so I'm so grateful that we got on this call then and everything worked. But the unpredictability of when it's going to work and why it doesn't work, sometimes it's me, sometimes it won't let me in, nothing to do with me. So it's hard for me to predict when it's going to work and when it's not. And that's just the technological part, the complexity of trying to figure out, I'm the CEO of our organization, so I'm holding up my staff. I'm trying to figure out what's the safest way for us to stay in business and deliver the service that we do that doesn't risk my therapists and doesn't risk our families. And the impact of everything we do virtually, the safest way to do that, of course, is to only deliver our service virtually. That has implications to the effectiveness that we can be when we can't connect face to face. That's a complexity. The social political issues in the background are not it's this or that kind of thing. It is so complicated and so hard to make sense of. It doesn't matter where on the scope and the spectrum you are and any of those issues. It's complex. Trying to decide how to navigate for our kids learning virtually, how to navigate supporting other people. All of that makes us feel like a whirlwind of complexity that we get overwhelmed by. So keep in mind our definition of trauma: feeling extremely upset and at least temporarily overwhelmed in our internal resources. So right now, I would like you to begin a list to reflect, for me, what am I feeling most challenged by on a day-to-day basis in my life, my personal life, however COVID and everything else going on in my life, how that's impacting me, what it's meaning for me, what I'm having to navigate, what is that meaning for me? And then in my work life, as an educator, whatever your role is, what is most challenging for me? You're witnessing families really struggling. You're seeing children who are having behavior and emotional challenges more than you've ever seen. If you're delivering your work virtually, or if you're having to navigate your classroom face to face, but with masks on, navigating half days with one group, half days with another, you're all navigating and managing this differently. And it's very unpredictable for you from one day to the next. So what's hardest for you in the work that you're doing? Just name that and begin that list for yourself. And in relation to that, how am I feeling? And I really do invite you to not only right now and throughout the rest of the presentation, pay attention to that and notice that, but reflect even more after today. I'm going to share some things in a little bit that will help you reflect and stay mindful of managing that. So my invitation today, and I'm going to invite you to start with to write these two words down: mindful and intentional. Mindful and intentional. Write those down. My invitation to you is to be mindful and intentional. Those are two things that we absolutely have to be to come out looking like the thriving tree. And by mindful, I mean basic mindful concept. Mindfulness at its core is nothing more than noticing without judgment. Notice without judgment. Notice what you're feeling, don't judge it. Notice what you're doing, don't judge it. Just notice it. We'll do something about what we notice. If we judge it, then we shame ourselves, and then we go into an even more spiral. I'm eating badly. I know I'm eating too much. I'm eating way more chocolate chip cookies and potato chips than I should be, and I'm comforting myself. I know it. I shouldn't be doing that. And then we eat more because we're shaming ourselves because we're being so bad doing that. No, don't do that. Just notice without judgment. Mindfulness can include spiritual practices. We think of mindfulness in a spiritual domain. We certainly associate mindfulness with meditation. Those are great. Practice them and use them. Notice without judgment and practice those mindfulness practices. But mostly what I mean is just notice without judgment. And then what's my intention? I notice that I'm eating in a way that is self-soothing. So I'm eating less healthy foods, or I'm not eating and I'm just pushing through and I'm not taking time to stop and eat lunch or to have a healthy snack that keeps my blood sugar up so that by the end of the day, I'm not completely depleted and exhausted. That's one of the practices that's really helped me, one Zoom after the other, being attentive, being on, sometimes presenting, sometimes being present in a coaching way, attending. It's very tiring, plus being on screen is tiring. What you do is tiring. What do you do to keep your energy level up and to replenish it? And one of the things that I wasn't doing that I noticed, mostly without judgment, is I'm very vulnerable around blood sugar. So I need to keep blood sugar up. If it gets too low, and I don't even have like any blood diagnosis of anything. It's just if I go too long and my blood sugar gets low, I get lethargic, I get irritable. I have a hard time managing the frustrating things, much more vulnerable about how I manage that. And so I'm really making a concerted intention to eat protein and some things that I know are a good mix for keeping my blood sugar up. That's just one example. I'm an avid cyclist, so my other intention is we can notice that we're not doing what we love as much because we're too tired or we don't have time. We give reasons why we're not doing things that we love or that we know that are good for us. So my intention is I'm not going to let my cycling fall back. I'm going to make time for it no matter what. And I'm going to even have accountability partners. One, because I'm an avid cyclist, I do have a core team that I ride with of 5 people. We do it by distancing. We do it with masks. We can still be out there. And they know whether I show up on a Saturday morning or not, or on Tuesday evening, 5 o'clock. I'm exhausted. I'm hungry. I'm tired. I no more, as much as I love cycling, I no more feel like changing, getting out there, meeting them, driving over. I'm just too tired. But if they're waiting for me and they know I'm not going to be there, I, like most of us, I will show up. But if it weren't for them, like, well, I'll go tomorrow night. And then tomorrow comes and I've got reasons why not. Just notice and be intentional about what you want to do differently. This is how I'm going to support my resilience. We all have vulnerability during this time. You know yours. We all have emotional vulnerability. Our families, Leilani and I were on that consult today, as long as I was able to be on it. And they were talking about their school, the enormous percentage of kids that are not showing up for school. They're all virtual right now. And I think it's probably like, they gave a number out of the number of kids, but it's like 200 kids that are, have the number of absences that put them in the category of truancy. 100 of them are 15 days or more, and they're just not coming. And then all the reasons why, and the vulnerabilities of the families why. We're going to make the assumption families want to do better than that, and there's barriers that are getting in their way for doing that, but the enormity of what the school is facing with that, how do you reach that many families? We've made 13 calls to that family trying to figure out why they're not showing up. How can we support you? How can we help you? And having no success. And the pain that we feel for that family, if we're making a generous assumption they want to do better than that, they just don't have the resiliency to do it, or the resiliency skills, or the resources. So what's our own vulnerability emotionally to COVID? We all worry about getting it. We all worry about somebody we love getting it. We're all we all feel vulnerable about how we're teaching or educating, whatever form, because we're having to do it differently and we feel less effective. What's your vulnerability? Notice without judgment. And I think sometimes we take for granted what we're doing and the enormity or the severity of what we're seeing. I don't know all your circumstances and what you're seeing in your world and the communities you live in, the families that you know from your school community, what they're dealing with. We are all dealing with grief these days. Make no mistake about it. Even if we've lost nobody to death, to COVID or anything else, we are dealing with grief because we've lost so much, at least temporarily, that we're missing. We've lost connection. We've lost our ability to be in school the way we used to be in our communities, to be out with our families. We have a lot of losses, some of which we know are temporary, but we get overwhelmed with that feeling this will never end. We're seeing the suffering and loss of others. And to think that we can see that on a daily basis and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. Any of you able to walk through water and not get wet? I can't see everybody, but Lilani, are you noticing anybody raising their hand? Yeah, nope, I don't think we can. We can't get through this pandemic and what it's meaning to us as educators or us personally without getting wet, probably even soaked. But that said, we can survive it. And so let's talk about stress. Stress has its good forms, its tolerable forms, and its toxic forms. Good stress are even the good things that happen to us. We can be preparing for a marathon and training for it. And now it's the day of the marathon and I'm having some performance anxiety. Am I really going to be able to do it? What's going to happen if I don't? I'm going to feel so embarrassed if I don't make it to the finish line. Or my thing is always if I'm 2 hours later than everybody else. Whatever the performance anxiety is, that's kind of a good stress. It releases some anxiety that actually produces adrenaline. And some adrenaline is what focuses us. It gets us pumped up, so to speak, literally and figuratively. And it gets us ready to perform, whatever that performance is. Even something like this today is a good stress. I'm looking forward to it. I love what I'm doing. I'm wholehearted about the message I want people to get about trauma. I'm wholehearted about the meaning and purpose of my work, what I can contribute hopefully to the audience I'm going to be training. And yet it's stressful. Is the technology going to work? That's my first question. There's some, is it going to be effective? How are people going to receive it? But I know that I can manage it. And it's also what I'm up to and what I'm feeling good about. When you show up to school every day, you feel that same kind of thing. It's your meaning and purpose. You're not sure how the day is going to go, but all in all, you know that you can manage it. And then we have things that happen that are pretty much in the realm of normal, the normal teaching stressors, the things that we deal with at home that are normal. We've dealt with this before. I've got this. We've got this. I've got somebody who knows I can go to so-and-so. If this happens, Lilani knows that if she's got some trainings to be on back to back and she can't be present enough for her boys to be virtually, she knows she's got a mother-in-law or mother who can come and help her out. I've got a resource. So this stress trying to figure out how do I work from home with 2 young boys in elementary school learning virtually. It's tolerable because she has a sense of her own competency and agency to deal with it. And she's got a resource, 2 mothers and or a partner. So it's tolerable because I have resource. And then there's toxic stress. Now remember what Nadine said about the impact of trauma, abuse, neglect, chaos when we chronically release and activate our stress response. When we're in toxic stress, we're overwhelmed. We don't feel like we can affect change. We don't feel like we can navigate. I have no mother, no mother-in-law around. I don't have the money for daycare to send them there while I'm working. I don't know how I'm going to do this. So I'm feeling anxiety, I'm feeling fear, I'm feeling powerless, and I have no resources outside myself, and I don't feel like I can cope with this at all. That's going to release cortisol. It's going to release adrenaline. It's going to cause an anxious response. And in an ongoing way, that's what a lot of us are living with. So those are the 3 kinds of stressors. And it's important for us to really label our emotions. Anxiety, we're going to talk in just a minute in another slide about how important it is to label what we feel. But for example, when we feel anxiety, we feel like I'm dealing with something I can't impact a change. I don't know what's going to happen. It's unpredictable. I don't know when. I can't do anything about that. What happens if this? And we do that worrying. That may never happen, but we still are worried about it happening. That's anxiety. When we feel fear, we feel like something bad is right around the corner. I live on the Bosque in Albuquerque, and so I can go down to the Bosque and I can take a walk. And if I turn the corner and I come face to face with a coyote, which I have, I'm going to have a fear response. Oh my God, do I run or he'll chase me? If I just stand here, if I get big and yell at him, what do I do? So, okay, I figure out what to do and I get away from it. But the next time I take my walk down the Bosque, every time I come around a corner, a bend of some kind where I can't see, I'm going to feel a fear of impending danger that that coyote could be around that corner again. So I'm going to have to do things. I'm going to go around that corner cautiously, or I may decide before I go around any bend, I'm going to yell and make a lot of noise because I know that mostly a coyote will run off if I'm noisy. But I'm anticipating with fear a response I need to have. That's those kids, those Tommies. They're always vigilant for fear of what's going to happen that I can't predict. We're in this pandemic. We can't predict from one day to the next whether we're going to be teaching virtually or we're going to be teaching hybrid or we can go back face to face. We can't predict whether we're going to get COVID or not. We can do what we can to prevent it, but aren't we all having some anxiety and or fear when we listen to the news and the rise again in the number of positive tests? We feel a sense of pressure. How I perform is going to be the outcome of this. So whether it's performing as a teacher on a day-to-day basis, whether it's performing in a training like this, our performance, the outcome is going to be based on our performance. So if I do it poorly, it's going to be poor outcomes for my students. If I do it well, it's going to be good outcomes, but I'm feeling anxiety and fear about being able to do it well because I'm having to do it in a way I was never taught. I was never taught to deliver therapy, telehealth. I was never taught as a teacher to teach virtually. I was never taught how to navigate in a classroom, even face to face with kids having masks on and teaching. I'm splitting my class up in 2 different groups, 2 different lesson plans. Every group is different. I wasn't taught for that. I wasn't prepared for that. So that's a lot of stress. So we just need to name what we're dealing with, because if I realize it's anxiety, my own self-intervention to regulate that anxiety and my response to it, or my fear, keeping a perspective. You know, it's kind of that 1 minute I'm cursing Zoom because I'm so over it and the technology. And the next breath, I'm giving a prayer of gratitude for it because it's how we keep teaching. It's how we keep delivering our service to the families that are most vulnerable in our clinic, in our community. It's how we are literally staying in business and keeping our jobs. So trying to keep that balance between what I'm so frustrated, understandably, by and what I'm also grateful for. I'm as entitled to my frustration as I am for the gratitude I need to be in and the perspective I need to keep, but don't judge either one. We need to ask, how's that working for us? You know, Dr. Phils, how's that working for you? Yeah, this guy is cutting off on the wrong side of the limb. He is definitely going to take a fall, literally or figuratively. So we need to pay attention. What is it we're feeling? What is it we're noticing? What we're doing for ourselves to support our resiliency or that will deplete our resiliency? I want you to write down this question. Is what I'm doing right now supporting my resilience, or is it depleting it? And I use the silly example of at the end of my day, I used to watch the world news at 5:30. And I realized that was depleting my resilience because while I was trying to be informed on what's going on, and like never before, day to day, things are changing politically, socially, COVID-wise. I want to be informed, but I watch the news and I feel more depleted than before. while I might be somewhat informed, that newscast visually is meant to evoke that emotional response. So what I'm choosing to do instead is do my stretching routine and a breathing routine for 20 minutes, and I read my news on my app so that I am informed to the extent that I want to be, in a way that's not quite as evoking of my stress response and doesn't deplete my energy. That when I finish my day and go into my evening, I'm not so depleted that all I want to do is watch TV I don't even care about, because I'm just too tired to do anything else. So just noticing, what are you doing and how's that working for you? The 4 R's, and again, Leilani can provide the resource for this, I think, or send anybody what we want, what's needed. But these are really important. In relation to these 4 R's, what do I notice how I'm doing and what I'm needing is kind of the question that goes along with these. Recognizing is everything I've already talked about. It's naming it. It's what are we dealing with? We're dealing with a pandemic. I'm being impacted by that in this way. The challenges I'm having as a result of that are. We just recognize that it's there. And we just, it's the being able to see the barriers, being able to see the challenges. Again, not with a lot of judgment, just them's the facts. Then we look at our resources. To deal with this, what are my resources? Kind of, again, what I've already talked about. Who can I get to help me? Who in my world can come and watch the kids while I have to do this? Something as simple as that. What are my internal resources? What are my external resources? Who in my school do I go to for this? And instead of just being angry about, what would be the resource I would have to be able to go to and get what I need? What are my internal and external resources? What regulation do I need to be mindful of and intentional about? How do I calm myself after a very frustrating session like today, when I had my session with that school? I honestly, by the end of that, was pretty exasperated. And I definitely felt the tension in my body. I felt some fatigue. It was right before lunch. I lived just 3 blocks from my office. So I went home, I got something to eat. I vented a little bit to Leilani, and connected with her, planning for this. It's like, oh my God, what's not gonna work in the next one? And feeling that frustration, that anxiety about what I can't control, that fear, this is gonna happen again and I'm gonna look bad to all these people, or they're not gonna get what they're showing up for, all that self-talk. But honestly, I did notice that, and I paid attention, and I got back to the office in time, connected with Leilani, got what I could set up, and I took about 5 minutes in a chair in my office and did some deep breathing and some affirmations. Affirmations for me are really regulating, and it got my neural pathways back to the upper part of my brain. It got me physiologically really calmed down, so that when I got on screen, I hope I looked like I was present and I wasn't exasperated and I wasn't too exhausted to even show up for this. That 5 minutes really made the difference for me. So it's, what can I do to regulate myself? Stop long enough to be able to do that. But we tend to forge forward, keep going, and not do that till we're just exhausted at the end of the day. Relating. We are literally brain-wired, hardwired in our brains rather, to connect with other people. And the interesting thing is so many adverse things that have happened over the generations. If you look back, like to my parents' generation, they were the Depression generation, the World War II generation. Then I'm giving my age away, in the 50s and 60s, raising my generation, and some of the things that happened in that generation. But you know, all the adversity that they faced, there was a sense of community and connection and being together, whether it was people in the military together, whether it was the women back home together, making the workforce work. There was community, and we used community and connection to support us in that adversity. That's hard to do in this particular adversity. We're behind masks and screens. So looking at, in terms of managing what I notice I'm struggling with the most, who in your life do you look to that you can relate more with, even if it is behind a mask, even if it is on screen, reaching out by FaceTime? Hate to be on screen even more, but on the other hand, if I call that friend somewhere else that I haven't connected to in a long time, and I always feel so good when I get done talking to him or her, and or just connecting or listening to them, or, you know, I know she's dealing with 2 boys also, and I just want to connect with another mom that gets it, what I'm going through. Isn't it helpful when you talk to somebody and they see you for what you're dealing with, because they're another mom dealing with, or another teacher who knows my world teaching, or another clinician in our world? There's just something about that. Didn't change anything. You didn't make COVID go away. You didn't make my husband any more helpful, or not. But you just kind of know my world. That connection, that empathy makes all the difference. And we're getting less and less of that. So we need to call in how it is we can relate and connect and call in on our resources. That's part of connecting instead of being in isolation. So looking at those 4 R's, what they mean for you, and how, where are you inside of those, and what can you call on to better regulate, relate more, recognize it. What is it that I'm really dealing with and going through? Name it, and then find my resources. So we avoid the overwhelm, because if we don't do that, we're going to be so overwhelmed that we feel like we can't cope. Mark Brackett. This is really some great resource and work for educators. He's in the educational world. He's the director of the Child Development Center, Emotional Intelligence Development Center, or something like that for Yale. And he wrote a book called Permission to Feel. Phenomenal book and phenomenal work. It's in specifically education, and he has what's a process that he uses in the school called Ruler. And actually it's implemented in about 2,000 schools across the country and in some other countries. His whole idea, though, is we need to teach kids the social emotional skills of feelings. So, you know, if we can name the feeling, we can tame that feeling. But if we're having an overwhelm of feelings and we can't name what they are, that's when we get reactive in our brain, or we just simply shut down, or we have that 4th glass of wine, so I don't even care anymore. We do things to numb ourselves out, or we get explosive. So we need to figure out how to name what we're dealing with. And his Ruler acronym is recognizing, so this is your early educators, early childhood educators. You are in a phenomenally important role, second only to the child's parent, and in some case, maybe even more important, because some gaps that parents have to helping children with this, you can absolutely bridge those gaps. You can make up for what those kids aren't getting at home. Not judging the family. They're doing the best they can with what they have. It's not about that. It's just, I'm sad to see what this child is dealing with and he's not getting what he needs, or I know what adverse things he's going through, and I can't make enough difference for him. But the truth is, you can make an incredible amount of difference. You see them on a day-to-day basis. You are in an incredibly privileged and powerful position to make a difference for them, and especially as early childhood educators, because you're so upstream before they're having all the ramifications of the lack of social, emotional, and academic skills that as they get older is going to have them be unsuccessful and excluded in so many ways. So what a privileged place and a powerful place for you to be. and a purposeful place for you to be. On a bad day, don't forget that. So recognizing our feeling and the feelings of others, that's the first skill. So we're teaching our kids by reflective languaging to recognize their feelings. We need to recognize our own feelings. Then we need to understand those feelings. What causes me to get triggered by this child? What causes me to get triggered by the politics, the social stuff going on? I get fired up, to use my son's word. He uses that word with his kids a lot. Oh, and you're just getting too fired up. Now we need to stop and do yada yada. So we get fired up. What causes me to get so fired up? A friend of mine said something the other day. I have known this friend since I was 10 years old. That is more years than I want to admit. So we're very close, but she said something that just evoked an emotional response in me. And I honestly, the first response I labeled was anger. I was angry at what she said, and it was about social political stuff. How could you think that way? I kind of was getting fired up, and I had to stop and think, why am I feeling this way? And I don't care that she thinks politically or socially different than I do, honestly. That's just an opinion. That's just a belief. We can believe things differently. That wasn't my trigger. I did disagree with her, but the emotional feeling I was having that was triggered wasn't that. It had something to do with values. And without going into it, I had to clarify what was the cause. And the other thing is, if I allow myself to react to her and continue to argue that particular debate, so to speak, that we could have continued with, it could have gone south as a conversation real fast, but it also could have had a real negative impact on our relationship, because she could have gotten way judgmental and I could have gotten way judgmental, at least in my language, even more than I really feel. And there could be some harm to that relationship. So I had to recognize it. I need to understand what the trigger is so that I don't have those consequences, because in no way would I ever want to be hurtful, and in no way would I want to create a gap in our relationship. So I had to label what that trigger was, and I had to label my feeling better, and then I had to express them. And in this case, who do I express it to? And it isn't necessarily her, because it's not really her. It's what I'm feeling, and the distraughtness I was feeling about that issue is about that, not her. So I went to my resources, which were some people in my life, I am so triggered by this. And I shared it with them, and they listened, and then they were reflective, and I had my feelings. They kind of saw them for what they were. I knew they wouldn't be judgmental, even though I was being judgmental. You're a therapist and you're being that judgmental. They didn't say that. So I felt safe with them, and I was able to kind of process it and think it through. So one, I got that emotion more regulated. That was the regulation part. I got myself to be less fired up, and I got myself calmed down. And then I figured out what to do about that cause. So without going into the details, I mean, think about what distresses you the most, from mild distress to a high level of stress. There's always feelings, and our feelings are always, and our assumptions are always the driver to our reaction, to our brain reaction, our hormonal reaction, and our behavioral reaction. Feelings are always the driver. So that's what we're helping children learn and to regulate. So kind of thinking in terms of those 5 things, what can you do to identify what that child is feeling, what you think is the trigger for that feeling for that child. You can label it so you can help them label it, teaching them skills to express it more appropriately. Just last night when the grandkids were visiting, my grandson sort of hit out at my granddaughter. It's usually the other way around. I was a little surprised. And she was ready to bop him back. And I stopped her and said, Ava, don't hit him. Owen, you need to have him say you're sorry. And he didn't. And so my wife was standing behind me and I wasn't being quick enough to tell Owen, tell Ava you're sorry. So my wife said, make him say it. Owen, tell Ava you're sorry. I'm sorry for hitting you. Does he really get the empathy? No. Pattern, repetitive, repeated experience activates that part of the brain. So he said it. She didn't want to give him credit for it. Ava, say that's okay, thank you. That's okay, thank you. And we moved on. So it's how to regulate, how to express. That's the teaching. You do that every day as an early childhood educator. That's what we're doing for our kids. Pay attention to these 5 pillars of resilience. Our relationships help us be resilient. Foster those relationships. What am I doing to foster relationships in my life that are rewarding? Maybe even notice what relationships am I not paying enough attention to that I could get more rewarded from. Or in some cases, like my friend of more years than I want to admit, you know, what could I be doing that's actually fostering more stress in that relationship? Let's just say we will agree to not agree and we won't talk politics right now. And that's okay. So paying attention, what's fostering resilient relationships and what's contributing to those relationships not being rewarding, because we tend to do that when we do it more with the people closer to us than anybody else when we're stressed. Pay attention without judgment, but what's your greater intention? Pay attention to your physical health. Notice what things you're feeling, more physical fatigue, more physical ailments. We can be really healthy and not have medical diagnoses, but we all tend to be, when we get stressed, we have headaches or stomach distress, or if we have a certain condition in our body, that's always where stress is going to show up, and that's going to get worse. Pay attention to that, because it might be the stress that's exacerbating that, or if you're having symptoms you've never had, we always need to check out medically. But on the other hand, I didn't used to have back issues, but now I'm having back issues. Or I didn't used to have sleep issues, but now I'm having sleep issues. Sleep is the heart of resilience. When we don't get sleep, we release those negative hormones. Emotional health. I don't think I need to tell you how attentive we need to be to our emotional health and what promotes our emotional resilience or depleting our emotional resilience. Pay attention to your eating habits. Do they contribute to resilience, or are you eating in ways that don't contribute to your resilience? They just contribute to your waistline and to your other health issues. So really noticing, paying attention, and what's your intention? What can I do about it? I know I need to do more exercise for my physical health. My intention is to do this, and then follow up with that. What's your buffer? My relationships are my buffer. My exercise is my buffer. For me, spending time with my grandkids is a buffer because I'm in sheer joy. Honestly, I have a dog right next to me. He's at work with me. He's a buffer, taking him out, playing with him, doing that breathing exercise, and affirmations are a buffer for me. What's my buffer? Write that down. What's my buffer? Because all too often, we don't go to that resource. I'm too tired, I don't have time, and I don't do what I know is good for me. That's my buffer. Who are the people in my life that are my buffer? How do I call them in? And who can I be the buffer for? It's not just who can be that for me, how can I be that for them? Because when we're in service to other, it also releases positive hormones, dopamine, and the hormones that make us feel good are the things when we do affirmations, when we do spiritual practices, when we're in service to other people, when we practice gratitude, it releases our positive hormones and calms our brain down. Our tools to thrive are acceptance. I'm kind of speeding up a little bit because I'm realizing the time. But we need to have we need to have tools to thrive. And again, we can provide these for you later. We need to practice acceptance. I cannot control that there is a pandemic. I accept that there's a pandemic, but inside of that, this is what I can do. And I can adapt. If more we fight adapting, the more angry we're going to be, or the less control we're going to have. If I can adapt, that's control. And control is one of the things that helps us feel like we can do something. The good hormones and the bad hormones. I joke about, we're not talking about the gender hormones exclusively. Those are good hormones, although they can have us behave kind of wonky, those male hormones and female hormones. And they're part of what make us feel good and drive us to feel good things and drive us to crazy decisions. You know what I'm talking about. But those aren't the ones I'm referring to. I'm referring to what I've been talking about earlier today. So some of this I've made reference to already. The hormones that are the positive hormones, serotonin is a positive hormone. Dopamine can be a positive hormone. Oxytocin is a stress hormone. Adrenaline is a stress hormone. So you can see by these, this chart, when we're high anxiety, we're low in dopamine. When we're high into depression, we're lacking serotonin and dopamine. That's why we take antidepressants or anti-anxiety things. It's to raise serotonin level. When we are feeling in love is connection. That can be friendship. It can be intimate affection. It can be feeling part of community. Then it raises our oxytocin. It raises our serotonin and our dopamine. When we're in stress response, we release adrenaline and cortisol. So that's just an awareness of what hormones are we releasing. And so we practice noticing what zone we're in. This again is from Dr. Brackett. When we're in the blue zone, this is a great chart to use for your kids, by the way. And his book, Permission to Feel, very applicable in his work, very applicable in early childhood settings. I really encourage you to look into his work. But the blue zone, you can read these. Those are the stress hormones. Our happy zone, we're going to release the good hormones. Yellow hormones, we're frustrated, we're worried, kind of the negative ones. And of course, when we're red, it's all adrenaline and cortisol. So we really want to be as much in the happy zone as we can. And we just notice where we are without judgment. How can I bring myself from red back to green? How can I bring myself from the blue, the low energy, back up to a higher energy? And that's regulation skills. Viktor Frankl, psychiatrist and survivor of the Holocaust, reminds us that forces beyond our control can take away everything from you, everything you possess except one thing, the freedom to choose how you will respond to the situation. And while this is not the Holocaust, it is a very stressful time. And we absolutely can choose our response. We can look at what we can control and work within that. We can look at what we can influence and work within that, and have an acceptance that for right now, I can't control this. I can't even influence it. And I can think about how I can develop that. But in the meantime, I look to what I can influence and what I can control, so that one, I keep a perspective. Two, I have a sense of agency and optimism that I can impact this. And that will help us be resilient. I'm going to make generous assumptions about my parents, of the kids in my class. I'm going to make generous assumptions about my kids. I'm going to make generous assumptions about everybody that we're all doing the best we can. You know, we even need to make some generous assumptions about our leaders, that they're doing the best that they can in managing this stress and the pandemic and the decisions that are being made. I want to remind us that there's no more effective neurological intervention than a safe relationship. That's certainly true for the children who've lived a lot of adverse events, but it's also true for us. So be that safe relationship for others and seek out those safe relationships for yourself. They will sustain us in our vulnerability. They will sustain us in the courage to keep facing day in and day out what we are dealing with, and they will be absolutely the foundation of our resilience. Sometimes the bravest and most important thing we can do is show up. That's what you're doing every day, in spite of the vulnerability, in spite of the fatigue that we feel. And I'm going to remind you, as I already kind of talked about, when you close that screen at the end of the day, mostly don't open it again unless it's to connect in a positive way with a friend. I'm going to get on FaceTime and I'm going to talk to my good friend in some other place so that it's about connection. It's not getting it just on Facebook. It's not something that's going to renew me if you're going to be on a screen, but shut it down so that you go to whatever it is that renews my energy, my resilience, rather than depletes it. Shut it down, do whatever it takes so that we are paying attention, noticing without judgment, so that we don't keep going, keep forging, just having grit without those tools and without mindfulness, so that we have intention, so that we avoid hitting that wall. Because honestly, all too often, we don't see the wall coming. So that's why we need to be so mindful and intentional, so that in the end, and on a day-to-day basis, we thrive. And that's it. These are some of the references. I'll leave that on for right now. And again, Lalani probably is providing some information. So I haven't been able to see the chats. I know it's time. If anybody needs to jump off, please feel free to do so. I know when I went up to the last minute, my apologies. But if you want to stay on, if you have any reflections, questions, anything more you want to add in the chat for Lalani to respond to, please do. But anything, Lalani, you want to reflect from the chat for everyone. Nothing like putting Lalani on the spot.
I almost pushed the leave button instead of the unmute. I'm glad I did it.
Yep, technology.
Yeah. No, it's been a really great chat. There's been a lot of support for one another and encouragement that we will get through this year and that we will make it meaningful. It's been really great seeing what people are saying and some of the resources that are being shared among each other. So I appreciate it. And I certainly do wish everybody the best of the year and that you do make it meaningful. You know, it's really in our power to do so as that spheres of influence. You know, it is in our control.
And Dr. Pierce, on behalf of United Way of Mission Families, I just wanted to thank you for offering all of us this session. It was fantastic. I took a bunch of notes too, so thank you, thank you.
Yeah, well, thank you for having me. It's always a privilege. And any way we can help, on the screen there is our website. You can go to that website. Our phone number will be there. By all means, feel free to be in touch with us. You can just leave a message on that main number for Lalani or I, and we will absolutely be back in touch.
And we'll be sending out a link to the recorded session and would really appreciate getting your feedback to our survey. And we'll send out a link to that survey as well. And thank you all for spending your afternoon with us.
Thank you, everybody, for taking the time. I so appreciate it. Wow, a lot of chatting going on, Leilani. I just saw the number. That's great.
I think I did most of the writing, but it was good.
Great. Thank you as always for that.
Of course. Yeah, there were some good questions and some good, not necessarily challenge, but really thought-provoking. There was one question that I've never seen anyone ask before, and it was really asking about why Tommy's brainstem was developed, or underdeveloped, excuse me, because the individual was under the impression that the activation of the brainstem being, you know, like going through fight or flight would make it more developed than, like, say, Amy's. And so that was really an interesting thought or viewpoint. And so, you know, I sort of just explained that it's really the fight or flight and the toxicity that, you know, the chemicals that are released as a result of cortisol that actually impair the development. And that's why it looks that way. But it was really an interesting outlook on it. And so it was nice to see that people are actually really critically thinking about what
Yeah,
you're presenting.
Well, that was my thought. Good question. And it certainly reflected some critical thinking and investment in it.
Yes, certainly.
So thank you both so much. I'm going to end the
Yep.
meeting now.
Thank you for having us
Thank
again,
you.
Sandra. And we'll
Yes.
keep
Thank
in
you.
touch for
Yes,
sure.
we will. We will.
Uh-huh.
Thank you so much.
Bye-bye, Sandra.
Bye-bye.
Bye.